Hi everyone. The case study that I chose this week was case study number one, and it was Jasmine, a 6-year-old girl, presents at the clinic for a 2-day history of intermittent left-sided abdominal pain. After reviewing her case study, the most possible diagnosis for her abdominal pain was likely functional constipation. I came up with that diagnosis based on her infrequent stools, which were 2 to 3 times a week, her diet that was high in bananas, rice, whole milk, things that can all be constipating. Pain was relieved when she passed gas, and left lower quadrant pain, which is common with constipation. Functional constipation is considered a great disease burden in children that needs to be early screened and detected. The prognosis of functional constipation is better in children with prompt and proper management. General physicians and pediatricians are usually the first person who take care of these children. Hence, understanding the pathophysiology of functional constipation can lead to proper management and satisfied outcome. And that's from Trans and Senestech 2023. Um, Other possible considerations for diagnosis would be lactose intolerance, early appendicitis, urinary tract infection, possible things like celiac disease, or IBS, but all are less common than functional constipation. What additional history and questions would you ask Jasmine and Anna to narrow down the differential diagnosis? Questions would focus on bowel habits, diets, and things like that. Bowel history: how many times does she go to the bathroom a day? Does she go every day? Are the stools large, hard, painful? Is there any bleeding when she goes to the bathroom? Dietary habits to ask about is fiber intake. Does she eat fruit and vegetables? How much water does she drink? Things like that. Pain: when exactly does she have the pain? Does she have it after she eats? Is it before meals? Does it wake her up at night? Would be something to look for. Other things which would be more of a red flag to worry about would be lack of appetite or anorexia, weight loss, poor growth, fever, signs of infection, blood in stool, things like that. Question number three: what laboratory test would you order to evaluate Jasmine's conditions? There really aren't testing for functional constipation. It's more of diagnosis by exclusion. Um, However, you would do a good history and physical exam, and you would look for things, red flags, bleeding, weight loss. Other things you could possibly order would be a urinalysis to rule out UTI, CBC to look for infection, CMP to check her electrolyte status. You really wouldn't do x-rays unless you suspected something like appendicitis and things like that. And even then, you wouldn't really do those. Um, it says the quote that I found was the laboratory is not recommended routinely to diagnose functional constipation. However, a clinician can order a thyroid function test, including a T3, celiac screening, vitamin D status, electrolytes, cow milk allergy testing, lead levels, CBC, ferritin, and urinalysis if there is a suspected history. And that's Bashar and Khan 2024. Question number four: what management plan would you propose for Jasmine based on your assessment? I would probably start with diet, because I believe that's the cause of her constipation. I would reduce the amount of milk that she took every day, increase her fiber with more fruit and vegetables in her diets, whole grains, increase her water consumption. If those things weren't enough, then maybe add a medication therapy like Marilax, things like that. And normalize the education that 2 to 3 bowel movements per week is not adequate, if there's pain. I would follow up in 2 to 4 weeks, and adjust the treatment plan then. Another quote I found was: because education and ongoing toilet training are considered key elements in the treatment of childhood constipation, interventions motivating children to defecate and improving the self efficacy of children in their constipation treatment are likely to be of great value. And that's Away 2022. Thank you.